Okay, so I was just saying that I'm going to be putting this, I'm going to be recording today's session so that you can see it.
Okay, thank you.
Okay, fine then. So welcome everyone, and great to see you again today. We had shared series that you had watched on that, I'd share the video for that one. So you probably have watched the lecture series, which tells you how to complete the forms and various kind of forms which are there. I have also shared the different type of forms with you, which we are going to be using today in the assessment. And so some details we had already discussed yesterday, that what are the things that we are going to be discussing in the assessment, or what is assessment. So today we are going to be taking up one scenario, and we are actually going to be role playing it and actually going to be doing that scenario to see that how the actual situation is, that how it actually happens. And of course, if you have any questions, any queries, then we are going to be taking those questions as we go along, and also towards the end. Fine. Is there any questions that you have before we start?
No.
Okay, so I'm going to be asking one of you to do the introductory 6. Okay, so I'm just going to share my screen, and then just put it in your head how to do the introductory 6, so that you can do it. Yeah, so while I'm just sharing my screen and bringing up the scenario. Okay, can you see this? Can you see my screen? Guys, can you see my screen? Yeah?
Yes.
Okay, so that's
Yes.
fine. So we had discussed yesterday that the way that we are going to be following is that there is 2 type of scenarios which you can get. Either there can be an in-hospital scenario, or it can be a community scenario. And the in-hospital scenario, you are going to get more of an acute type of cases, which can be anything like pneumonia, asthma, ectopic pregnancy, hernia, falls, fractures. These type of things, they are going to be coming for your in-hospital assessment, or the acute assessment that we are going to be doing. Also, in the in-hospital assessment, there can be head injuries and subarachnoid hemorrhage, those kind of things, which also are going to fall in the in-hospital scenario. But for those, you are going to be doing a little bit of a neurological examination and a GCS chart for that one. The other type of scenarios that you can get is the community scenarios, in which you will be completing the news chart anyways, but along with that, there are 2 scenarios which are there, where you will be doing a must assessment, which is a malnourishment assessment, and then there is also a assessment for you can say the mental health of the patient, in which you are going to be using a PHQ-9 tool, which is going to tell whether your patient is depressed, and if depressed, then what is the severity of that. Yeah, so we are clear with these 4 type of scenarios which can come in your exam.
Yes.
So out of these 4, you are in the exam, you are only going to get any one. It is not that you will have to do all 4, but of course you will have to learn all 4, because you don't know which is going to be coming. Yeah, so now the example that we are taking an example for an in-hospital scenario, which is going to be like a post-operative care of the patient. So it is like an acute. Now, majority of the things are going to be similar in what we are going to do in other scenarios as well. But as we go along, I will tell you that how we are going to be looking into the other, if the scenario was GCS, what different things you will be doing, or in PHQ-9, or in the what are the different things that you will be doing. Fine. So you are going to be getting in the exam, you are going to get this type of a candidate briefing, or the notes to the candidate, which is very important that you read these properly, because this is going to tell you that what you are supposed to be doing. So if you, like, we take an example of this scenario, it says that you are an adult nurse working on the surgical assessment unit. So it is telling you that what your role is and in which unit you are working. Then it also tells you your task. It says that please conduct a holistic assessment of the patient's physical, psychological, spiritual, and sexual care needs. As part of your assessment, please complete an A to E assessment. Now, we did discuss yesterday that we will be doing an A to E assessment, which is going to involve your airways, breathing, circulation, disability, and exposure. And once you have done your A to E assessment, you will record your patient's vital signs, such as the blood pressure, temperature, pulse, oxygen saturation, respiratory rate, and you are going to complete a news chart and calculate a news score. And you are also going to be checking that what is going to be the monitoring frequency and what is going to be your escalation strategy, whether you are going to be escalating the care or not escalating the care. Now, then it also says that depending upon the patient's circumstances and conditions, you may wish to focus on some areas of assessment in more depth than the other. Like say sometime if the patient is having anxiety related with this post-operative care, like over here, we can see patient is very, very anxious. So you might need to explore a little bit more about the anxiety, that why they are anxious, what make it worse, whether you need to do something about that anxiety, whether there is maybe patient is anxious because they have little children at home. So whether you need to do something about it. So you might have to ask a little bit more in
Sorry
depth.
to
Yeah.
excuse me, whether if the patient is anxious, I couldn't see it.
It won't say it. I'm just saying that
Okay.
it is possible in the scenario. It is like
Okay.
that. Yeah.
Okay.
So it is
Yeah.
not saying over here. I'm just giving you an example that
Okay.
that there might be some things which you might have to ask a little bit more in depth. Then it also says that please note that there is no need to remove the patient's clothing to assess exposure. Yeah. So please don't ask the actor who is over there that, oh, can you just pull up your trousers or something like that. So there is no need to ask that thing. You are only going to be asking that if they have noticed any rash or something. Yeah. So please ask the examiner for any additional clinical information that you require. So things like if you want to check that whether all of your equipments are clean and calibrated, then you can ask the examiner that thing, that any information that you require, any extra sort of thing that you require to make sure that you are safely practicing and safely doing your task, then you can ask the examiner for that. Yeah. Then although they have already will be giving you this thing that all of the equipments are cleaned, checked, calibrated, and they are clean. So they have already given you the answer for this one. And an observation chart is provided and must be completed within this station. And you will need to complete it using the green pen. This also we discussed yesterday, that you will be getting different pens for different tasks that you will be doing. And it says that you will have 20 minutes. And in 20 minutes, you will have to complete your task. It tells that you have to assume it is today and it is 10 o'clock in the morning. So it will give you the time, date, and all your role, what you have to do, what you have to complete. So it is going to tell you your task completely. So please make sure that you read it properly, so that you understand that what you have to do, what is your scenario, and what are the instructions which you have to follow. Okay, after this, you are also going to get this like a A4 sheet like this one, where you will have the patient's history. Yeah. So there is going to be a brief history of the patient. So you will have to have a read that history. So have a quick glance at that history and know that what are the patient's concerns, why is the patient come to the hospital, or what has been going on in that thing. And also along with this, you will get this sheet. Now, this is the sheet which is this is kind of a rough sheet. So in this sheet, you can use to note down all of your the history, or if you're taking any notes, or when you are doing, like if you have checked the temperature, you can write it down over there. The pulse, you can write it down. The blood pressure, you can write it down, so that you have already written it in one place, and then you can easily copy it into your news chart. So you can use this sheet to take any notes which you are required to take. Okay, so any questions so far in these ones? Okay, if there are no questions, then Rekha, I want you to start by.
Sorry. You mentioned some four, is it four scenes? One of which is in hospital, community. What are the other two?
So there are mainly two types. There are in hospital and community. In hospital, there are two types, news and GCS. And in community, there are two types, the must and the PHQ-9.
Okay.
So in
okay.
total, that is how it becomes 4.
Okay, thank you.
Yeah. So Rekha, can you start by doing the introductory 6? This is the patient which is in front of you. It is an in-hospital scenario and I will act as a patient. So I will be answering your questions. So just do it as if that you are actually doing it in the exam.
Okay. Hello, good afternoon. My name
Good
is
morning.
Rekha. Oh, sorry, good morning. There is a 10 o'clock. Okay.
Good morning.
Yes. Today I'm coming to you to do a 2E assessment or an introductory 6 assessment. So may I ask your name, please?
Yeah, my name is Ash Potter.
Okay, my name is Rekha Meghani. I'm one of nurse or whoever I'm coming to give a care today.
Okay.
Okay. Do you have any, may I confirm your date of birth as well, please?
Yeah, it's 1st of January 1950.
Do you have any allergies?
No, I'm not allergic to anything.
Okay. Can I check your wristband and documentation as well, please?
Yes, you can.
Yes, I can see here you wearing a white band, so there is no any allergies. And okay, so in introductory 6, I need to do that hand hygiene one.
That is the second part of your introductory 6. What is the first part? So you will make sure that you enter the room safely.
Safety.
Yeah, so that is the first part. The second part is that before you approach your patient, you are going to be doing hand hygiene using WHO guidelines. So can you show me how you are going to do the hand hygiene?
Yes, first we need to wet our hand. If it's ink available, we need to wet our hand. And then we can take a soap, then palm to palm.
We are just using gel, hand gel.
Okay, gel. So then we can take a gel, palm to palm.
Yeah.
Back of finger, front of finger, finger enclosed, fingertips,
finger interlocked, then thumb rotation, then your fingertips.
Okay, then wrist to wrist.
And then wrist.
Oh, so it's a sequence we need to follow, or any sequence we can do that?
It is better that you follow it in this sequence.
Oh, okay. So because that's why I was just doing that seven step.
No, it is always a good idea to follow a sequence, because then you will always follow the same sequence and it becomes like a muscle memory. Each time if you do it differently, you will forget something or the other.
Mom, can I ask you one thing? How do they interlock, interlace the up palm
like
both sides? Or like that? Not like that?
That is the back of the palm you are doing that way.
Okay.
And then you are interlacing it.
Okay.
That you are interlocking it.
Interlocking it. Okay. Okay.
Okay. So that's fine. So we did the you did the safety check. You did your hand hygiene. Then the third thing is introducing yourself, which you did. That I'm Rekha Meghani. I'm one of the I'm one of the nurse working at the surgical assessment unit.
Okay.
Then you are going to do patient ID check. When you do the patient ID check, you are going to be asking the name, date of birth, and the hospital number. Remember, this patient is in the hospital. Yeah.
Okay.
So you will be checking the name, date of birth, and the hospital number. Although over here they have not written the hospital number, but it is going to be there in the hospital number. So and that you are going to be checking against the verbal sort of thing that the patient is telling you. that you are going to check against the notes which you are having. Yeah.
Okay.
And the third thing is that you are going to be checking against the wristband of the patient. So these are the three-way ID check that you will be doing.
Okay.
Once you have done the three-way ID check, then you will check for allergies. Again, you did that one. So I told you that I'm not allergic to anything, and you will you have also confirmed that yes, I'm wearing a white ID band, which is fine. After this, your sixth thing is that your purpose of your visit. Yeah, so then you will say that, okay, Terry, okay, Ash, I read from your history that you are over here because that you recently had a surgery, but you have noticed that your there is some issue with your scar or some issue with the wound that is happening. So I'm over here to do an assessment and take history. And in the assessment, I'll be doing an A to E assessment where I will require to take some vital signs such as your temperature, blood pressure, pulse, etc. Yeah, it is going to take me around 15 to 20 minutes. Is this a convenient time? Are you happy for me to go ahead? Yeah. So we are setting the purpose and we are taking the consent. Okay. So once the patient says that, yes, I'm happy that you can go ahead, then you will start that, okay, I'm going to be, before I start, can I just check, are you in any pain? Are you comfortable? Yeah, because there is, patient might be in pain. They are having kind of a query infection of the scar. So it is, and they are post-surgical. So it is possible they are having some pain. So it is always a good idea and to show a caring, compassionate thing that you have checked with the patient that are they in any pain. And if the patient says that, yes, I am in pain, then please make sure that you follow it up, that you will be asking that, okay, if you are in pain, can you rate your pain on a scale of 0 to 1, where 0 is no pain and 1 is, 10 is like the worst pain. So it's a 0 to 10 scale. Yeah. So according to it, whatever the patient says, then the next thing that you will be asking is that, have you taken any painkillers, or do you want me to get you some painkillers? Yeah. So most likely the patient will say that, yes, they have taken something because they want you to now proceed ahead with the examination. So if they say that actually the pain is not that bad, so I'm okay, I don't need it. So then you can check that, are you okay for me to then go ahead and do the examination? And then the patient will say that, yes, go ahead. Yeah. So, but please make sure that you have checked for the pain and that patient is comfortable. Okay. So then you are, we are going to do an A to E assessment. And in the A, it is airways. So how are you going to be assessing the airway and breathing? Vinita, can you tell me that how will you assess the airway and breathing?
Airway and checking any obstructions in the airway.
Yeah. So how are you going to check?
If speaking.
Yeah. So if I'm talking to you, that means my airways are okay.
Okay. Yeah.
So it is more of an observation that you are going to be doing. You have already spoken to the patient. You have already asked the patient's name, date of birth, all those things, and patient is answering.
Okay.
So one way of figuring out whether my airways is patent and not obstructed is that to see that I'm talking. Also, I'm swallowing, I'm my spit and all that. So it is, the airway is looking patent. Yeah.
Okay.
So you can comment. You can just make this observation. So that, okay, Ash, in my A to E assessment, the first thing I'm going to be checking is airways. So I can see that you are talking and that you are able to swallow the spit. So your airways is looking patent. Now, what are you going to be assessing in breathing?
Breathing, we are checking any weave.
Yes.
Using any muscles.
Yes.
Then one more thing is stride. Stride and
no. If I'm breathing like that,
short of breath.
Short of breath. So this is the first thing that you will see, that whether the patient is short of breath or not. Yeah, because you can actually see it. So whether you are going to check whether the patient is short of breath or not. If someone is short of breath, then they will be using the accessory muscles,
Okay.
And there might be some wheezing or stridor, depending upon what is the problem. Yeah.
Okay.
So if they are asthmatic, they might be having a wheeze.
Okay.
Yeah, so you are going to be commenting on that, I can see that you are not looking short of breath, and that you have not, you are not using any accessory muscles, and there is no wheezing or no any extra sounds, which is breath sounds that I can see. So your breathing is looking all right. Now I will move on to C, which is circulation. Okay, so in the circulation, Rise, so circulation comes to you. So what are the things that you will be checking in circulation?
All right, circulation. I'm going to be checking. Okay, the first thing I'm going to be checking is capillary refill. I look at patients' capillary refill. Press my thumb on the patient's finger. Before I do that, I'll first of all acknowledge the fact that there is no injury to the finger, no injury, no pain, no signs of cyanosis, no bluish discoloration. I'm happy to continue. So I press the the nail bed for 2 to 5 seconds, and expect it to refill within 2 seconds after removal. And then I acknowledge it.
Yeah.
And then I go ahead and check the SpO2.
Yes.
Right. And then I acknowledge the results and take note of it. And then I go to confirm that the BP machine has been cleaned and calibrated.
Yes.
I take the BP. Before I take the BP, I'll first of all request from the patient which of the hand will be preferred to be used.
Okay.
And then he tells me the right hand is okay.
Yeah.
I will confirm from him or her that there is no injury. He has not had any surgery. There is no injury, not having any pain. And he says so. And then I'll go ahead and apply the cuff of the BP machine. I apply to the upper arm, the right arm, covering 80% of the upper arm.
Okay.
And 5 to 6 cm away from the cubital fossa.
2 to 3.
2 to 3 cm away from the cubital fossa.
Yeah.
And then I go ahead and take the BP.
Okay.
Blood pressure, and then I record. After taking the blood pressure, I will tell the patient what the blood pressure is.
Okay.
Yes, let the examiner know as well, and then I will document.
Okay, well done. So you did very well for the first attempt. So it is great. Now, if we start looking at the C thing, the things that you missed, I'll just recap on those ones as well. So for C, definitely that is what we are going to be doing. So now we want to check the circulation. So in the circulation, first of all, we want to check the perfusion and the capillary refill time. So that is basically telling how good your perfusion is in your peripheries. So you can check the patient's hands and see that if they are warm, because that means that a warm hand means that their circulation is good. Then you are also going to be checking that they are not wearing any false nail or nail varnish, because if you're checking the nail bed should not have anything on top of it. Yeah. So you need to also make sure that the patient is not wearing any false nails or nail varnish. And then you can comment that, okay, the nails are not looking blue or discolored or cyanosed. Yeah. So then you are going to be pressing on the nail bed for 2 to 5 seconds and then leave it. The color should return back within 2 seconds. That means that there's a normal capillary refill time. Once you have done that, you are going to be putting the oxygen saturation probe, and you will you can let it sort of get the oxygen levels of the patient. In the meantime, you can start doing your blood pressure, Or you can start doing the blood pressure first and then you can do this one as well, vice versa. Or you can also do it one by one as well. So whichever way you want to feel like. So imagine that we have got the oxygen saturations now of the patient. So please make sure that you have written your oxygen saturations on this sheet over here. Yeah, so you write your capillary refill under 2 seconds, you write your oxygen saturations over there. Yeah. Then
breathing.
So breathing is okay. Over here, we want to write breathing. Also, you can write that okay, it's normal.
No, oxygen saturation is come here.
You can write under breathing. So yes, you can put oxygen saturations over there. Yeah. So as long as you have written somewhere, because no one is going to check this sheet, but it is a good idea to keep on writing it under that section so that it becomes easy for you to complete your chart.
Okay.
Yeah. So then when we come to the blood pressure. So for blood pressure, the first instruction that you need to give to the patient should be that, okay, can you please make sure that your legs are uncrossed and you relax. Yeah. Then you can ask the patient that which arm would they prefer for the blood pressure. So whichever arm the patient says, you can ask them that, okay, in that arm, have you recently had any surgery or is there any redness, swelling, pain over there, or is there any cannula or central line or anything in that which prevents you from using that arm? Yeah, you wouldn't want to put your blood pressure cuff on the arm if there is some swelling or if the patient has had some surgery. So you want to make sure it is safe for you to use that arm to take the blood pressure. Okay, so it is very important that you ask these things. Once the patient has confirmed that it is fine, they are not having any pain, no surgeries, nothing else has been done, then you are going to be telling the patient that this blood pressure cuff is clean and calibrated. Now I'm going to be putting it on your upper arm, 2 to 3 centimeters above the antecubital fossa. It is the correct size that I have chosen, and it is going to cover at least 80% of your arm circumference. So you are going to be tying it and making sure that the tubing is in line of your brachial artery. So once you have done that, then you are going to be warning the patient that, okay, now when I started, it is going to squeeze your upper arm. Yeah, so you might feel a little bit of an discomfort, but don't worry, it is only going to last a very short time. Fine. And then you are going to press the button of your electronic blood pressure machine and then get the blood pressure readings. Once you have got the blood pressure readings, make sure that you write it down immediately and make sure that you have copied it correctly. Because there are quite a lot of people who somehow in nervousness or because they are anxious, they copy it wrongly. And hence it get copied wrongly on your news chart as well. So please make sure that you copy it correctly on your sheet. Yeah, so once you have done that, then you can take the blood pressure cuff off and you can keep it aside. So now you have done your, for circulation. Now there is one more thing that is left, that is your pulse. So how will you take the pulse? Tell me that what are you going to be doing to check the pulse?
Yeah, to check the pulse, I'll have to check the pulse with the respiration for 2 minutes.
So what are you going to tell the patient?
I am just going to tell the patient that I'm going to check the pulse for 2 minutes.
Yeah.
And after I've taken both pulse and the respiration, then I'll have to explain to the patient that I've taken both pulse and the respiration. And the reason why I couldn't inform him or her before I took it. So, and the reason being that if the patient is aware that I'm taking the respiration, the patient might be conscious or kind of,
Yeah, and that might change the respiratory rate.
So change the respiration rates, which might definitely affect the rates.
Absolutely. So if I say that the patient's pulse is 72, how are you going to be explaining it to the examiner?
You mean the pulse 72?
Yeah. So what are the other 3 things that you are going to be telling along with that? That your pulse is 72.
The rate
Yeah.
is okay.
72.
Is it me?
Yeah. Yeah, you can carry on. Yeah.
Okay. I'll tell the examiner that the pulse is a bit low for the age.
No.
No.
So then you describe the pulse. How do you describe it?
Okay. I will describe the pulse as that the pulse that I check the strength and the strength and the reading, then the quality.
Yeah. So what exactly are you going to say? Okay. So we are going to say that your pulse is 72 beats per minute. It is regular and it is good volume. So what we are saying is we are telling the rate, the rhythm, and the volume of the pulse. So these are the 3 things that we describe the pulse in. So the rate, which is 72 beats per minute, regular, which is the rhythm, and the good volume, which you are telling the good volume, or the volume of the pulse.
Okay.
So this is how you are going to be describing the pulse after you have taken the pulse and the respiratory rate. So in those 2 minutes, for 1 full minute, you are going to be counting the pulse, and 1 full minute you are going to be checking the respiratory rate. And you will need to then say after 2 minutes that I have taken your pulse in these 2 minutes. For 1 minute, I took your pulse, which is 72 beats per minute. It is regular and good volume. And the other 1 minute I used to take your respiratory rate. So your respiratory rate is 18 breaths per minute. I did not tell you earlier because I did not want you to be conscious about it. Okay. So now it is extremely important that you take the pulse for the entire 2 minutes. Please do not cut short over here. Yeah, because the examiners are also going to be checking that at what time did you start and what time did you finish. And if you finish before 2 minutes, that is going to be a red flag. Yeah, so please make sure that you make it very evident to the examiner that, okay, I'm starting now. And then you count full 2 minutes from over there. Okay. So even a few seconds is also not acceptable. Full 2 minutes mean 2 minutes. So please make sure that you do it for 2 minutes. Okay. So now we have done the circulation. Let us come to disability. So Vinita, tell me how you are going to be checking the disability.
I'm checking. Do you have any past history of anything?
Anything what? Anything can be so many
Are
things.
you diabetic?
No, I'm not diabetic.
Okay. And do you taking any, do you drink? Do you smoke?
Water. I drink water. So say if you drink alcohol.
Okay. Do you drink alcohol?
No.
Okay, that's good. And do you smoke?
No.
Okay. And are you taking any medication?
Yes, I am taking medications. I'm hypertensive, so I take the antihypertensives, and sometimes I take paracetamol. I also suffer with glaucoma, so I use an eye drops as well.
Okay, thank you. And how is your mobility? Do you use any? Are you okay?
I'm fine.
Okay, that's all.
Okay. So now tell me that what exactly does disability mean to you?
The mobility.
So over here, we are not actually checking the physical disability. We are not actually looking at whether I'm a disabled person as such. In that sense that I cannot walk or I cannot move or something. Not in that sense. What we are trying to check over here is that whether the patient is conscious or alert.
Okay.
Yeah? So those are the disability that we are checking. So you will need to make sure. Now, if I am talking to you, if I'm doing all those things, then of course I am conscious.
Yes.
And
Yeah.
I'm alert as well. But in the alertness, it is possible that I'm conscious and alert, but I might be confused. It is possible. An alert person or a conscious person can be confused.
Okay.
Yeah. So now the history that you are taking is to figure out that whether the patient is confused or not, or whether they are having any conditions or any disease which might lead to either drowsiness or confusion. Because
Okay.
you are checking for the alertness and the consciousness level. So when you asked me that whether I'm diabetic, what exactly do you want to know in that?
Okay. Okay. I am trying to collect the past history there.
Yeah, that is the past history. So, but in this section, if you are asking me about diabetes, then what is the information that you are actually looking for? When can I be disabled if I'm diabetic? Yeah, so you want to know if I get an hypoglycemia. In hypoglycemia, what happens? I'll get very confused. I'll get drowsy, isn't it?
Yes.
So that is what you are trying to check in the diabetes,
Okay.
that whether I have had hypoglycemic episodes, or whether I do get hypoglycemia, whether I'm on any insulin. So you want to check that one. Then when you ask alcohol, the reason why you are asking alcohol is because if I drink a lot, or if I'm under the influence of alcohol, I might be drowsy. Yeah.
Okay.
The drugs that you are asking me drugs because it is possible that there are certain medication which I might be taking, which will make me feel drowsy. Yeah. Then what are the couple of other things that you would want to ask? What are the other conditions where patient can be confused and drowsy?
After surgery, sedation.
Okay, under the anesthesia, but you know that patient has not had surgery.
Oh, okay.
Recently not had, or just now not coming out of the surgery. So have you heard of UTI?
Oh, yeah.
Urinary tract infection. So urinary tract infection can make someone very drowsy and very confused. So these are some of the things, and dehydration can also make confused and drowsiness. So you need to ask about, in this section, this is what you are going to be asking, that whether the patient is alert, conscious, and these are the conditions, or these are the things that you are going to take a negative history of, that yes, they are not getting the any other reasons for which they might be feeling the drowsiness. Okay, so are you clear now for the disability?
Yes.
Okay, so now tell me about the exposure. What are you going to ask in the exposure?
It's me?
Yeah, you can carry on.
Okay. Exposure temperature.
Yes. How will you check the temperature?
Using the thermometer.
Of course, you'll use the thermometer, but
thermometer above the what we called.
So we are using which type of a thermometer we are using nowadays? So these are the infrared thermometer that we will be using.
Oh, yeah.
Yeah, so we will point it just at the patient's forehead, and we are going to take the temperature.
Temperature.
Yeah? But in exposure, apart from the temperature, what else do you want to know? So you would want to know if there are any rash.
Okay.
Yeah? If there are any bruises, or if the patient is having any kind of pressure ulcer, or any cuts or swelling or anything that they have anywhere in their body. See, that is the reason that when we are doing the assessment in A&E, if you are there in the A&E, and if you are doing A to E assessment, they would be checking that whether there are any bruises, cuts, bites, any different type of rash which they are having, pressure ulcers, all those things you would want to know, that whether there is anything which is there. So that becomes your exposure.
Okay. Yes.
Okay. So now we have completed an A to E assessment. Now this A to E assessment is going to be there for all of your the stations, whether it is news, even in GCS, you will be doing all of these things, the temperature, pulse, blood pressure, all these things. In your PHQ9 and your MUST as well, you will need to complete your news chart. Yeah. So this is a major thing that you have done now for the assessment, that you have figured out all of these things.
We need to write it down in the exposure as well. No bruise, something like that.
You can write it down, or you will
Okay.
have to at least verbalize it. You will have to ask the patient.
Okay.
Yeah. So if you have verbalized it, then also you are going to get a mark for that one.
Oh, okay.
Okay. So after that, once you have done your A to E assessment, then you are going to be completing your news chart. Now, news chart, I had already shared with you the news chart. We also discussed yesterday how we are going to be completing the news chart. So are you all happy of completing the news chart? Have you got a news chart in front of you? Okay, Temi. What do you want to ask?
Yeah, I want to ask because there has been a kind of conflict about the normal BP in UK and the normal pulse. So I just want to know the range.
See, the range is there in your news chart. Yeah. So if there's anything which is falling in white, that is normal.
Okay.
And anything which is falling in yellow, orange, or red, that becomes abnormal.
Here, 200 is in white.
Yeah.
So how comes it to?
So that is what we are checking,
200.
the systolic blood pressure.
Systolic is
Yeah. So
above 150 is hypertension. Is that?
yes, that is fine. And it is, see, the charts that you are going to be filling. Now, we cannot 100% of the time and all of the time we say that whatever that is written over there is always going to be, that is exactly what you have to always follow. Sometimes we have to use the scenario and the case history as well of the patient. Yeah. So you will need to make sure that you are correlating it with the history. If you feel that there might be so many things that you see that, okay, the patient's temperature is feeling all right, but there is something which is not right with this patient. You might not be able to point out that what is that something, but that is your observation and what you are going to be doing. But as far as the chart is concerned, if there is anything which is there in white, that is you will be scoring 0 on that one. But I can appreciate that of course, if your blood pressure is going 200, then that is something that you might not feel comfortable saying that, okay, I'm not going to raise it. So you are definitely going to be raising or considering discussing it with your senior or with your next supervisor. So that is something which you are going to do on case-to-case basis. But as long as, but for the chart point of view, it is still going to be a score of 0 on that one.
Oh, yeah. That means no need to be escalate or anything. Just
if your score is coming as 0, yes, you are not going to be escalating. But say, for argument's sake, that your patient is having a blood pressure systolic of 200, then you can tell to the examiner that I'm not very comfortable with the 200, although your score is coming 0, but I'm still going to be discussing it with my senior. So that should be fine. Yeah. Any other question that you have on the news chart? Okay, so that's fine. So now we are going to move ahead. So you have completed your news chart. Now the news score that you have got has come as 2. Yeah, and that is because your respiratory rate was a little bit high. Now, what are you going to do with the respiratory rate of 2? Oh, sorry, the news score of 2. I had shared. What should be your observation or frequency of monitoring?
4 to 6 hourly.
4 to 6 hourly. Yeah. And whether you are going to escalate it or not?
Escalate it.
Yes. So anything which is abnormal, it might be a good idea to escalate it.
Okay.
Yeah. Now tell me, if your respiratory rate, if it was 26, what is going to be your score? Everything else is normal, only your respiratory rate is 26.
3.
Okay, and what should be your monitoring frequency over here?
Continuous. Minimum 4 to 6.
Okay, what should be your monitoring frequency?
4
Arise?
to, oh, sorry.
Temi?
You
Yes, Arise. What should be your monitoring frequency?
frequency of 3.
Yes. If there is your respiratory rate is 26, which Vinita says is score of 3, what should be your monitoring frequency over there?
It is hourly.
Hourly. Well done.
Yes.
So it is very important that you realize that if there is in a single parameter, if your score is 3, then even though your total score might also be 3, but your monitoring frequency is going to be 1 hourly, because in single parameter you have got that 3. Okay, so please make sure that you don't make this mistake. Okay, fine then. So that's good. So now we know we have done the news. Now we are going to be coming at your that after you have filled your news chart, you will discuss with the patient and you will tell that, okay, your score is so and so, and this is your monitoring frequency, and I will be escalating because I'm slightly worried about your respiratory rate, so I will be escalating it to my senior. Now, in order for me to make sure that I have a holistic history, or I do an holistic assessment, I will need to take a little bit more history from you. Is it okay? Yeah, so patient will say that yes, it is okay. And then you are going to be taking the history with regards to, then you can ask the patient that, okay, how are they with their day-to-day activities? Are they managing their daily routine? Are they able to walk without any problem? Are they able to climb stairs or go to the toilet? Are they able to do their day-to-day activities? Then psychosocial, you are going to be asking that what kind of their social life is, that whether they are single, married, living with the partner, what kind of a house they are living in, because sometime now for this patient who is having a surgical wound, it is possible that they are finding it very difficult to climb the stairs. So you might need to know that what kind of a house they are having. Are they living on ground floor, or they have to live in or they're living in a flat, they have to climb stairs. So you would want to know that. You will also want to know that how have their mental state been? Are they feeling depressed or low mood? Are they otherwise social? Do they have friends? Do they talk with the friends? Are they happy in their life? So all these kind of things you can ask in psychosocial. Then in spiritual, you can ask, like that is more to see if someone is particularly a spiritual person, if they follow any kind of religion, if they want some kind of, like if it is something which you need to be aware as a nurse, that they might be praying at some time, they might be having some religious text or something which they want to be treated in a particular way. So you will need to know that whether they are a spiritual person, whether there is any particular thing they want you to do. You can also tell them that there is like what kind of facilities are there in the hospital, if they want to see a priest, or if they want to go to do a prayer, or there is a multi-faith sort of prayer room, they can pray over there. So all these things. About the sexual history, then it depends whether it is relevant or not relevant. So you can ask in that one. You might also want to see that are they happy for you to call them as he, she, whatever gender they are identifying it, or whether there is anything else that they would like to be called. So you can clarify that as well, because that is, as a nurse, it is important that when you are looking after the patient that you are aware of that one. Yeah, so this is after you have taken all of this thing, that is going to give you a holistic assessment of the patient. And then
Excuse me, ma'am. Can you say sexual what need to ask?
So you can ask, it depends on whether, say if it is an ectopic pregnancy that someone has come. Yeah, okay. Then it is important that, okay, that you can check that how are they, that whether they will be having any concerns with regards to further trying for pregnancy, whether they are anxious about it, are they in a relation, how are they with their partners, are they happy in their married life? And so you can ask all those kind of questions over there.
Okay.
But there is
Okay.
also a thing that sometime it is possible that there might be a same-sex couple. Yeah, and or it is like that although I'm looking like a girl, but I identify myself as a male. So it is possible that I would say that, okay, call me a he, or call me a they, or don't call me a she. So sometimes it depends upon the sexual orientation of someone as well. So it is like scenario to scenario, you might have to see if it is relevant.
Okay. In this scenario, we can, in this relevant.
So in this, it is not really relevant over here, but you can still ask that, are you happy for me to address you as a he?
Okay.
Yeah, and the patient will say yes, then it is fine.
Okay. Only that question here.
Yeah, that should be all right. Yes, Temi?
I want to ask the patient that came into the hospital with a wound. When do we assess the wound? As in, during the exposure, do we need to check the wound site or something?
No. So over here, remember, it is your the assessment that you are doing is A2E assessment with the holistic history. You are not doing the wound assessment over here.
Okay.
Yeah, so you are not going to be going into that okay, I'm doing a wound assessment.
Okay, thank you.
Okay, fine then. So now we come to the closure of the station. So in the closure of the station, you are going to tell that, okay, Ash, I have taken all of your history. I have also completed the chart that I was required to complete. Now I am going to update your notes and document everything. And also I'm going to be discussing it with your doctor. And we will come back and do the assessment of your wound. In the meantime, is there anything else that I can do for you? So do you need anything to, are you comfortable otherwise, or do you want me to get you something to drink or something? And you can ask them. And then you will say that, okay, that's fine. I will leave a call bell anyways. If you require any assistance, please do not hesitate to call us. And then you do your final hand hygiene and you can leave. Any questions in this one? Okay, that's fine. So now I think that while now that we have completed the how do we take the history and how do we do every A2E assessment and thing. So I'm not going to be repeating the same thing for the rest of the 3 scenario. I'm only going to be discussing how the charts are different and what you are going to do in that one. So the next one, the chart that we want to discuss is your GCS chart. Now imagine if there was a patient who had come with a fall. Yeah. So if there was a patient who has come with a fall and had a head injury, and that patient is because it is a head injury, you will need to do an assessment of the neurological assessment for that patient. Yeah, so in the neurological assessment, you know that yesterday we saw that how the chart looks like, the GCS chart, and what do we need to do with the GCS chart. So I'm just going to share the GCS chart so that you can have a look. Okay, can you see the GCS chart?
Yeah.
Yeah.
Can't clear, ma'am. It's not clear.
Yeah. Can you see it now?
Yes.
Yeah. So in the GCS chart, you will do for the patient, we are going to do the introductory 6. After the introductory 6, the first thing that we are going to be doing is check the patient's GCS. Before we move on to the A2E assessment, we are going to do the GCS of the patient. Yeah, now in the GCS, you can see that there are eye-opening, verbal, and best motor response. Now, how can you check all these things? Rekha, can you tell me that you have entered the, you have done all of this thing, introductory 6, and you tell the patient that, okay, I'm going to do an assessment on you, and I'll start with the GCS assessment, and then I'll be checking your blood pressure, temperature, pulse, etc. And I will also do a little neurological examination where I'll need to check your pupils and the strength in your arms and legs. So your GCS, how are you going to do that?
Okay, first I need to write down the name of a patient here. I need to fill it out first.
Okay,
part
so you
that.
have filled that one, yeah.
And then we need to go through like eye opening. So it is a coma scale first. So inside is eye opening. So we need to check it. Is a spontaneous to is a non.
So you are talking to this patient for the last 2-3 minutes. You have been checking their name, age, or their date of birth, and etc. etc. Surely you would have noticed that they are opening their eyes spontaneously.
Yes, we need to check like that way, like is the opening wide or how it is. Then we need to mark it like that way.
Yes. So what you can do is that it is just like we had an observation for airways. Like we did not check anything. We just observed it, that the patient's airways are patent. Same way, you do not need to check whether anyone is opening their eyes spontaneously or not. When I'm looking at you, I know your eyes are open spontaneously, isn't it? So that is an observation. So you can start by saying that, okay, my first thing is to check your eye opening. I can see that you are opening your eyes spontaneously. So that goes in your spontaneous eye opening.
And verbal response, when I ask them, a patient, if reply me back nicely and like that, then I need to just say, you are not confused or some like anything, not look like confused or anything.
In order for confusion, what do you normally check? Like oriented. So you need to check for orientation. What do you normally check to know that whether you are oriented or not?
Patient are replying back like
for orientation, you normally will ask the patient about the time and place that they are in. You know that sometimes you say that, oh, I'm very disoriented in this place. Disoriented because you cannot make out where you are. You will still remember your name, date of birth, and everything. So your name, date of birth does not tell you that whether you are oriented or not oriented. So for orientation, you will ask the patient that, okay, do you know where you are and what is the time? What is the current time? Yeah. So if the patient tells you that, yes, I'm in the hospital and it is in the morning around 10 o'clock, then you know that the patient is oriented to time and place.
Okay.
So you can ask these questions to say if the patient is oriented. And then the third one is your best motor response, in which you want to check whether the patient is obeying command or not. So you can ask just a simple give them a simple command that, okay, can you look up or can you raise your arm? And if the patient is doing that, then it means that they are obeying your command.
Okay.
So you can write, either you can tick this one, either you can put a dot over here, or you can write the numbers. So I can write the numbers over here and about all these things. And I know that my GCS is 15 out of 15. So there is a place over here where you will have to write your GCS. So you can write 15 over here. Yeah. And then you go on to do your A2E assessment. You can say that I can also see that your airways are patent, your breathing is all right. Then you will check all the blood pressure, pulse, respiratory rate, all those things you are going to be checking. And you are going to be marking it over here in this chart accordingly. Now, please make sure that this chart is slightly different than the chart which is in your news chart. So over here, there is your blood pressure and pulse and respiratory rate. These are all you are going to be marking over here. But you know that your respiratory rate is not going to be more than 30 or anything. And your pulse cannot be less than 30. So it is not that you will be overlapping that thing. So you can just write, if my respiratory rate is 18, I can just write over here. If it is 20, if it is not 18 or if it is 22, then I can write in between over here as 22. Yeah. Or I can put a dot over there. Yeah. If my pulse is 70, I can just write, I can just mark it with a dot. Say 72 was my pulse, then I can mark a dot over here. Oops. I can put a dot over here. Yeah. And then I can put my blood pressure. If my blood pressure was say 145, so I can put like this one. And if it will, the lower one was say 80 or 88. So I'll just put it over here. This should be the inverted one, but I don't have that thing over here. So, and then you are going to be marking it, or you can say, I can put it like that. And then you are going to draw a line over here to say that this is your blood pressure.
You don't want to write the number, is
value.
there?
No, you don't need to write the numbers. Yeah.
Okay.
And then you have to see the temperature. Now in the temperature, there is no space left over here to write the temperatures as well. That's why they have written the temperature on the right hand side. But it does not mean that you are going to be noting the temperature over here. Yeah. So if my temperature is 36.5, I will just drag it over here and I will mark it in between over here as 6.5. 36.5. Yeah, over here. Okay, so this is my only column that I will be using. Yeah, because this is the column which I am using for this time. Okay.
Okay.
So this way I'm going to be completing all of these readings. And then once I have done my A to E assessment, then I will tell the patient that now I'm just going to check your pupils, as I said earlier, and also the power in your upper arms and your upper limbs and your lower limbs. So in order to check your pupils, I will be shining this light. So you take the torch, and with the torch, you are shining the light in one eye and the other eye. And you will be seeing that what is the size of the pupil and whether the pupil are constricting and relaxing. So that is the reaction that you are seeing. You know that how when you shine a light, what is going to happen to your pupil? Constrict, because there is too much of light coming in, so your pupils are going to constrict. Yeah, and as soon as you take it away, they are going to dilate. So that means that your pupils are reactive, that they are constricting and dilating. So, and the size of the normal pupil is usually around 3. So these are the size which they have given, but 3 to 4, any of this thing it could be. So what you can do is the right size, say the 3 is my size and it is reactive because it constrict. So I'm going to put a plus over here. And same in the left side as well. I'll do that one and I'm going to put a plus over there. Yeah. Okay. So this is how you are going to do your pupils. And then we come to the your power. Now, in order to check the powers, all I will need to do is ask the patient to put their arms forward and I will try and push them down. So you will ask the patient to try and resist when I push down. So that is the more, if you are putting pressure down and patient is able to resist, that means that they are having good strength. And if they are not able to resist, that means that it is weak. Okay. And same thing you will do with the legs as well. That you will ask the patient to, you will put a pressure, either put pressure and ask the patient to raise their legs, or ask them to raise their legs and you put pressure and you ask them to avoid that. Okay?
Normally we are getting the normal power, is everybody.
It is not necessary. Like if in the script to the actor who is playing as patient, if the script says that your left arm is weak, mild weakness in the left arm. So when you will be checking the left arm, the actor will drop it down. Yeah, because this is in my, I can either show my power or not show my power. Okay. Yeah, so it is possible that it might be.
Then where we need to write it, the left arm, there is no specify their left arm or right arm.
Imagine that you are saying that your right arm is having normal power and your left arm is having mild weakness. So you are going to write against the normal power, you will write an R because that is your right arm. And against the mild weakness, you will write an L, that your left arm is having mild weakness. And if in the legs, say both of the legs are normal, then you are going to write R and L
L.
together.
Where? How right? RL together. Okay.
Yeah, against the normal power.
Okay.
And the last thing is that you are going to write your oxygen saturations. And that is going to complete your GCS chart.
Where is oxygen saturation going to be recorded?
Yeah. Rest of the information is going to be the same, that you are going to just take the history as we took in the news one. Okay, any questions in this one?
Sorry, where is oxygen saturation going to be recorded?
Here.
Oh, okay.
End.
Okay.
No, what is that? Rest of the observation. What is? I didn't get that.
Rest of the history. You know
Rest
that you
of
have
the
to do
history.
that.
That means physical, psycho. That's the thing.
Absolutely. Yeah.
Oh, okay,
These
okay,
things.
okay.
Yeah.
All right. If we have to use the GCS score, depending on the patient you have, that means we will not need to record the new score.
No.
Okay.
So between the news and the GCS, you are going to do only one.
One. All right.
Yeah.
Mom, GCS score is 10 means what gonna happen?
10?
10 or
In the
something.
exam. So obviously your patient is not well at all if your GCS score is 10.
Okay.
Yeah? So there is something is really wrong with the neurologically. So the patient.
Then what we need to say?
You don't need to do anything at the moment. Yeah, because in the exam, it is not going to be 10.
Okay. Always
exam,
50.
It is either 15 or 14. At the maximum, your patient can be confused.
Okay, okay.
Because you have to do the rest of the thing. Who is going to tell the history and all those sort of things? Examiners, they have to mark you. No? If you are making your patient comatose, then how are you going to do the rest of the things?
Yeah, you're correct. Okay.
Okay, yes, Temi?
Okay, does that mean we don't have to escalate anything in coma?
Coma.
In
No,
GCS?
in GCS, see, GCS itself, if the patient is under the GCS observation, it is without saying the monitoring frequency is going to be 15 minutes.
Okay.
Yeah. So that is the reason that you are not going to be, because see, when you do the news chart, you want to find out that what is the monitoring frequency.
Okay.
But if you're doing GCS, you are going to do it every 15 minutes because the GCS patients, they can deteriorate very quickly.
Yeah.
Yeah, that's why you have to. So there is no, you don't have to actually figure out that what is the monitoring frequency. You already know it.
Okay.
Yeah? If the patient is absolutely fine, say for that you have done the GCS, and if your patient is fine for the next 4 hours, yeah, and nothing has happened, then you can move the patient to the news assessment.
Okay.
Because now they don't need any GCS observation. You can move them to the news assessment, and then you can do the monitoring according to the news.
Okay. Thank you.
Okay. Then after that, we have to tell the patient that your GCS is fine.
Yeah.
Something like that.
Yeah. You can tell that your GCS is fine. Your power is good.
Okay.
Yeah. And your pupils are reactive and everything is looking all right.
That means we are checking you every 15 minutes.
Yeah. So we will be keeping an eye on things. We will be checking you every 15 minutes to see if there is any deterioration.
Deterioration.
Yeah. Okay.
Then here also we need to say that, okay, do you have any doubts or doubt? I will go and document everything for you.
Yeah, of course.
Like that?
That is there for every station.
Okay.
Call bell and see, opening and closure of every station is going to be the same.
Okay.
So you are always going to tell the patient that, okay, there is a call bell over here, or this is how you need to ask for help if you require, and that you are going to do your hand hygiene, you are going to document, and you are going to leave the patient. That is going to be same for every station.
Okay. The date and time, everything is already written there, or we have to put the candidate?
Normally it is already written. These things will be completed for you.
Okay.
Okay.
Yes.
Fine then. So now there are 2 other things that we are going to be doing, which is the PHQ-9 and the MUST, which I'm going to do very quickly because I'm way over the time. So the must, as I have already told you, that these are going to be the community scenario, the must and the PHQ-9. In the must, you will have to complete your news. In both of them, you will have to first complete your news score. Yeah. So you will come and do exactly like the news score. So once you have completed your news score and you tell the patient that, okay, your news score is so and so, and that means that your monitoring frequency is so and so, then you can say that, okay, now I also see that in your that the doctor has also asked you, or there was a malnourishment assessment done for you as well, because we were slightly worried about your nutritional status. So I have got a chart over here, and according to this chart, your must score is, and you would calculate the must score like we told yesterday, that if there is a 1 and you add 1, 2, and you come up with a total score. So you can tell the patient that according to that, your total score is coming as 2, which means that you are at a high risk of malnourishment. So, and then you can go and say that, okay, there is, now that we have recognized that you are at a high risk of malnourishment, we will be putting a few things in place to help you overcome this. So first, the few things that we are going to be doing is that we will monitor your food, that what is your intake. So I'll give you a food diary in which you can keep on writing what you are eating. So we will maintain a food diary for the next 3 days, and we can check that how much you are eating and what type of food you are eating. Also, we will be making sure that we check your weight on a weekly basis to see that how your weight is doing. If you are having any problem with managing in cooking and all those or preparing food on your own, then we have an option that we can put you on meals and wheels, where there are ready meals that you can choose what you want to eat. So I will be happy to arrange that for you as well. And also I will be referring you to a dietitian who can also have a look at the food diary and also can go through your notes and make a diet plan for you. Yeah. And once all these things are in place, I will be repeating this must assessment in about a month's time to see that whether we are getting any better on this one. Okay, so I will share with you a sheet which is like a key of what kind of an advice that you have to give to the patient who are having a high risk, low risk, or medium risk of malnourishment. So you can use that one, and you can practice on this one. So it is, I think that it will be a good idea to practice on all three, because either you can get a high risk, moderate risk, or mild risk. So if you know what advice to give on all three of them, you'll be fine. Yeah. Now, same is the case with the PHQ-9. In the same way, like after you have done your news, you are going to tell the patient that I can see that you have also completed a PHQ-9 score. This is the tool that we use to check that how your mood has been over the last two weeks. Yeah. So let me just calculate and complete it, and then I'll be talking to you about what does the score says. So you are going to add all the score. You will come up with the total score, and according to that, you will be provided a key as well. Yeah. So I told you that for all of these things, you will be provided a key. So you are going to be looking at the key. Let me see if I have got the PHQ-9. So if you will see that I have shared it in the group, the key that is there. Yeah. So you can check that one, and that will say that if your score is so if your score is from 8 to 9, it is minor. 5 to 9 is minor symptoms. If it is between 10 to 14, it is the minor depression, dysthymia, or major depression. So if you are coming towards 14, it is coming towards major depression, and anything between 15 to 19 is actually major depression, or anything more than 20 is also major depression that you are there. But it is, even major depression is divided into mild, moderate, or severe one. Yeah, and
there is two column total and art total together. That means
yes. So the column total, like say how many ones which are there. Like if I have ticked 3 ones, then you will write 3 over there. And if I have ticked 4 2s, then I'll write 8 over there. And if I have done 1 3, then 3. So, and then the grand total is going to be the total of 1, 2s, and 3s.
Okay. One total. Okay.
Yeah. So like then
One grand total means total 8 is a 2 plus 2 plus 2, 8. It's not like that.
no, see, in the column total, you are going to do like
Mm.
you add all of the ones. If there are 3 ones, then you will write 3 over there.
3, yes.
Yeah. Under 2s, you will write, if there are 4 2s, then you will write 8 over there. And if there
Yes.
are 2 3s, you will write a 6 over there. And in the grand total, you are going to add the 3, 8, and 6.
Yeah. Okay. Yeah.
Yeah. So
Yes.
that is how it is.
Oh, yeah.
So once you have added, once you have got the total score, you are then going to give the advice to the patient with regards to, like it is written in the key, that your treatment recommendation. So if the patient score is 14, your treatment recommendation is antidepressants and the psychotherapy. But along with that, you are also going to give some more support to the patient. So you will tell that, okay, I can understand that maybe because of your illness, because you are lonely, that you are feeling depressed. So if the patient is in care home, you can say that, okay, there are a lot of activities which happen in this care home. You can, there is a common room. You can make friends. You can meet more people. You can join a chess club. You can, if you are interested in that, you can do gardening. You can read books. There are so many things, so many activities that you can do to keep yourself busy, and and socialize, and that is going to help you come out of your low mood. Along with that, you are definitely going to be referring for counseling, and also you will ask the doctor to start you on some antidepressants.
Okay. This was this score is already there. I mean, the treatment plan is already given
They will
in there.
they will give you exactly the sheet which I have shared with you. Only that your all of the 9 questions, they will be marked. What is the answer?
Okay.
Only the total you will have to do. But you will get the keys for that one.
Okay. Ma'am, one more thing. The score, you know, the BMI score, there is a 4 column. Anyway, one is going to be filled, is there?
So 1 and 2 are going to be completed for you. It is let me see if I can bring that one.
There's a 4 column. Then how gonna?
So what is the 4 column?
0, 1, 2, 0, 1, 2. That I didn't quite get that.
See, so what are you not getting in that? It says that if your score is more than 20, then you mark a 0. If it is between 18.5 to 20, you mark as 1.
Okay.
The score on the top, which is written, is like if you are, it's the same way, like there are so many columns in your news. It does not mean that if I'm going to repeat this again after a month, I can use the same chart. No? I can do the second reading over there, and the third reading, and the fourth reading.
Okay. Then I got one in BMI there, 1 score. Then the weight I got 2. That means 2 plus 1, 3. The total score.
Yeah.
Okay.
Yeah, and you can see that high risk.
risk.
Anything which is 2 or more than 2 is high risk. Okay.
Then I have to go through this this one score, minimal symptom of depression. Is that right?
No, it is in the must. You are going to do must,
not
depression.
Sorry. Okay. Okay. Anyway, that one you are going to give
Yes,
us.
I will share the key. I will share it with you.
Okay, lots of fun.
You don't need to get confused. I think that you are getting a bit hypoglycemic. You need to go and have something to eat. Okay, fine. So that completes our assessment. I know there is a lot to take in the assessment, but please take things one at a time and understand the concept. It is not difficult at all. And please don't get too much confused and do overthinking. Keep it simple. It is a simple exam. So please keep it simple. Don't go into that what if this and what if that, because the examiners are not going to give you anything to stumble you. Yeah, they only want to check that whether you know the normal things or not.
Okay.
Okay, no one is going to try and make it difficult for you. So please don't get worried about those things.
Yeah. Are you going to share the question paper? Are you going to share it in the group?
Now, the next thing you will ask me is that are you going to go and give the exam for us?
No, Mama, just try to understand the scenario and all once again.
Okay, I'll put this scenario on the group.
Okay, thank you.
Yeah.
Yeah.
Okay, so please watch this video again. It is there on the YouTube, so you can watch that one. And there are lots of other videos also which are there on our YouTube channel. Please make sure that you subscribe on that channel so that you can see all of those videos and go through all of the material which is over there. Yeah. So,
Mom,
yeah.
Sorry, Mom, you are going to post the today's live section also, the group?
Yeah, this is actually being live on the YouTube. So just go on the YouTube and you will be able to see. Yeah.
Oh, okay.
So I will share the link of it is Charcos Learning Center. If you put on the YouTube, if you search Charcos Learning Center, you will come up with our YouTube channel. You can subscribe it and then you will be able to see all of the videos.
Okay.
Okay. Fine. So tomorrow there is not going to be any class, and it is day after